Sacramento County is on the brink of changing the ways some mental health crises are handled. Under the current proposal, the Alternatives to 911 pilot program would create 4 two-person mental health response teams and a call center. It would be staffed by 5 senior mental health counselors and have a separate non-law enforcement phone number. It would operate Monday through Friday, 9 to 6, at a cost of more than $1.6 million. If approved, it would begin on July 1st. But there's mixed reaction to the plan.
It's a good start. It's better than what we currently have, which I don't think is sufficient.
I think that we need more funding for this program for it to be successful, for it to be accessible to all of Sacramento County, and for it to operate 24/7, 365, just like a hospital or a jail.
After hearing the pilot plans Wednesday, Sacramento County supervisors raised concerns. First, when the teams would be available.
I think this is too important to have it be abbreviated to just 5 of 7 days a week.
And having a separate phone number not connected to law enforcement.
There are 911 systems throughout the county of Sacramento that are operated by different law enforcement agencies. We cannot, as a county, act in an island and adopt a program that is not in some way in tune with the 911.
Then there's the cost. A staff report shows to change the current plan and have the program operate 24/7 could cost $5.5 million.
I don't see how we can do a program where there isn't money coming out of the sheriff's budget. How much? I don't know.
Supervisors were also concerned that police and fire chiefs weren't part of the discussion to design the program. So they've asked staff to assess the cost to expand the program to 7 days a week with 8, 16, and 24 hours of coverage. It was a unanimous vote to plan for a decision next month. I'm Brandy Cummings, KCRA 3 News.